with tonight's Fox Family and Health Report.
Thank you, Walter and Robin. Exercise, injury, age, and arthritis all can cause major damage to the knees. A knee replacement operation used to require weeks of recovery, but now there is a speedy surgery that gets patients back on their feet almost immediately.
How are you doing, sir?
Good, good.
Feeling pretty good?
I'm feeling great.
Just 9 hours ago, Grover Thomas underwent total knee replacement surgery and is now getting ready to leave the hospital.
Ready to go home?
I'm ready to go home.
Fantastic. Let's get you going.
Okay.
He's had a new procedure called a minimally invasive total knee replacement. Dr. Richard Berger is one of the few doctors in the country who does it. It's different from a traditional knee replacement because it doesn't involve cutting the muscle or the tendon.
What we do with this new surgery procedure is we make a much smaller incision, about this big, without cutting the muscle, without cutting the tendon, and still with these special instruments we're able to put in a regular knee replacement.
Grover, who's a marathon runner, said before the surgery that at first he had planned to go the traditional route.
I was going to have the traditional knee replacement. I was going to be in the hospital for probably 5 nights. And my recovery time was going to be quite extended, and I was quite distraught about that, but I was going to go ahead and do it because I needed it, and that's when I learned about this new procedure.
With his new knee, Grover is not only able to wear his own shoes hours after the surgery, but he's also able to walk out of the hospital with crutches.
They're usually on crutches like you saw for about 2 or 3 days. They get onto a cane for another 2 or 3 days after that, and certainly by a week, they're off everything.
And how does he feel as he heads home?
There's obviously some pain and discomfort, but it was much better than I expected.
One more advantage with the new procedure, there's no full anesthesia. Patients can have a regional anesthesia. That's similar to the epidural that women get during pregnancy. Now, Grover will still have to go through some physical therapy starting tomorrow. It'll last for about 8 weeks. But, you know, Dr. Berger says basically it's a 6 days of recovery versus 6 weeks with the traditional surgery. It really is amazing.
And you couldn't start physical therapy until after that 6 weeks, traditionally,
well,
correct?
You had to wait, right. Yeah. And this is using the same type of, you know, knee replacement piece. And he's working now on training other doctors across the country so that they'll be able to do this too.
Great. Thank you, Margaret.